Dear colleagues, my name is Christian Reich. I'm a dermatologist in Hamburg, and also on behalf of my co-authors, I want to briefly inform you about a study that we recently published in the British Journal. The name of the study is IXORA S. It is a head-to-head trial between ixekizumab, a new IL-17A blocker, and ustekinumab, the antibody that blocks the P40 molecule, which is shared by IL-12 and IL-23. Why are these studies important? Because if a new class enters the scene, we want to understand how the new drug compares to the champions that we had. And I think ustekinumab, in this sense, is a very fair and realistic comparison. How did we do it? Approximately 300 patients were randomized to either receive ixekizumab or ustekinumab. What were the doses? Ixekizumab was given 160 milligram at baseline, 80 milligram every 2 weeks until week 12, and then once per month thereafter, so exactly like we have it in the label. And also ustekinumab was given according to label, so 45 or 90 milligram, depending on your weight, with one shot at baseline, one at week 4, and then every 12 weeks thereafter. What was the primary endpoint? Primary endpoint, week 12, PASI 90. Why is this important? Because it documents that these higher levels of response are becoming the new reality. And this is good for our patients because we know that PASI 90 is linked with a higher degree of patient benefit. What was the difference at week 12? Massive difference, highly significant, 30%, 74% achieved this in the ixekizumab arm compared to 42% in the ustekinumab arm. Now many would say, yes, but Stelara is not full throttle at week 12. So it is important to understand and see, and this is also in the publication, that not only the PASI 90 difference, but also the difference of other endpoints, PASI 75, PASI 100, DLQI-01, was not only statistically significant difference at week 12, but the difference remained to later time points, and you have week 24 data in the paper. Safety, I think it is limited what you can conclude regarding safety from such a relatively small study. But I can say that there were no unexpected safety events, and the general safety profile was actually similar between the two drugs. I should also say that the patient population that was included here was a little bit different compared to other ustekinumab comparison trials, in that it strictly followed the ustekinumab label. So these patients, the European label, so these patients had to fail, or contraindications or side effects, to previous systemic therapy. So a more complicated subpopulation, if you will. The more important is it that this study clearly shows a superior efficacy of ixekizumab compared to ustekinumab. And this will help us and guide us how to use the new drug in our daily treatment practice. Thank you very much for your attention.